Hi everybody, thanks for joining. I would have emailed you a couple of packets. One of the packets is this one. It's called Meal Planning 0 to 6 weeks after surgery. This is where you're going to find some general guidelines as you're progressing through your diet stages. There's some general guidelines about your protein, your liquids, your meals. There's some popular protein supplements here, so if you haven't identified a protein shake that you like, I encourage you to maybe try one of these on this list. These are shakes that some of our past patients typically like. If you thumb through this, there's some recipes as you are progressing through your different diet stages, so that's a pretty useful packet for the first 6 weeks following surgery. The next packet is this one. I encourage everybody to read through this packet. This kind of goes into more detail about the new protocol, the new way we are going to be managing your post-op pain. So we're trying to reduce the amount of opioids used before and, well, I guess after surgery. So please take a look at this packet, familiarize yourselves with what will be happening and what we'll be doing before and after surgery to reduce your pain. Finally, the last packet, this one, is the one that we'll be primarily going over today. This is the packet that you'll find most of those frequently asked questions here, the answers, you'll find these, and it kind of goes over what to expect before and after surgery. It goes into diet progression, activity, and just some general concerns following surgery. So again, please keep this packet handy. It's a good thing now that you have it in your email inbox, so you can always access this, especially if you have one of those smartphones, you can access it on the go. So please keep this packet handy and refer to it frequently following surgery. So if you could, please break out that packet and we'll be going through it. So the first page of this packet just kind of talks about how the surgery is a tool. It's important to realize following surgery that surgery alone is not what is going to cause that long-term success. It's surgery along with a healthy diet and exercise. All three of those things combined is what's going to cause that long-term success that we're all working towards. The picture on this packet does represent what your anatomy is going to look like following surgery, so that's a good visual for everybody. And then if you flip to page 2, it goes into before surgery. So prior to surgery, we do ask that everybody go on a reduced calorie diet. What that is, it's 1,400 calories for at least 2 weeks prior to your surgery. We do have you reduce your calories significantly. What that's going to do is help shrink the size of your liver. It's also going to help decrease the amount of stress on your abdominal tissues. There are some programs that require a liquid diet prior to surgery. Here at Washington University, we do not require you to do a liquid diet beforehand. There is a liquid diet after surgery, we'll talk about that, but beforehand we just ask that you reduce your calories to 1,400. There's no limitations on texture, you know, what you're eating and drinking. You can eat what you typically do, I guess, but as long as it falls into that 1,400 calorie limit. If you burn up your calories at lunch, then it's going to be just a protein shake for dinner, okay? So if you have any questions, you can always call the office. Further down on that page, we do prescribe some preoperative anti-nausea medications. These medications will be called into your pharmacy. The two medications are Emend and scopolamine. These are long-acting medications that are going to be taken at 8 p.m. the night before your surgeries. Again, long-acting, and the medications are going to be the scopolamine patch will be placed right behind your ear, right here, and it's going to stay in place for 72 hours, 3 days following surgery. The other medication, Emend, is a pill that will be taken 8 p.m. night before surgery, and sometimes we do see insurance companies kind of give us a little bit of pushback with this medication, requiring prior authorization sometimes. So if that's the case, we will try to obtain that prior authorization If for some reason we cannot get that to be pushed through and insurance ultimately denies the medication, there are ways around getting that at a discounted price. Going to goodrx.com, that's GOODRX.com, and downloading a coupon will bring that down to approximately $35 for that tablet. Next, pre-surgical scrub. So at your anesthesiology visits, everybody should have those prior to surgery. They'll be giving you a special antiseptic soap that's been shown to reduce your risk of surgical site infections. The nursing staff is going to instruct you to wash with that the night before surgery and again the morning of surgery. So pretty much from your neck down is where you'll be washing with that soap. Again, night before and morning of surgery. So if your surgery is very early in the morning and you have to be at the hospital at 5:30, that is going to be a very early morning. We cannot skip that shower. You do need to make sure that you shower prior to coming in for surgery. Okay? On page 3, we'll go into the day of surgery. So we do ask that you arrive 2 hours early for your pre-surgery workup. At that point, anesthesia is going to meet with you, review your history, physical. You'll change into a hospital gown. They're going to start an IV on you and give you some medication through that IV that makes you pretty drowsy. After that, they'll bring you back into the operating room. You're going to be placed on a ventilator. It is general anesthesia. Your abdomen is going to be scrubbed and draped. Surgery will begin. For the sleeve, it takes about 1 to 2 hours, and for the gastric bypass, you can expect 3 to 5 hours. If you're having the duodenal switch, 4 to 6 hours. After surgery, they're going to wake you up and take you into a recovery room. They closely monitor you as you wake up from that anesthesiology. It's also called the PACU. You'll be in that unit for about 1 to 2 hours while you stabilize and wake up from that anesthesia. Your family and friends will be notified that are at the hospital waiting that if and when you are out of surgery and that you're doing okay. When you are stable and awake enough from that anesthesia, they'll move you up to your hospital room, and at that point, that's when family and friends can come up and visit. You can expect to stay 1 to 2 nights in the hospital. After surgery, you're going to have 2 post-operative appointments. We'll see you in clinic about 7 to 10 days following your surgery, and then again, we'll see you 6 weeks after your surgery. These appointments will be scheduled at the same time that your surgeries are scheduled. Moving on to page 4. After surgery, we do very slowly progress your diets just to minimize any adverse events such as nausea and vomiting as you're relearning how to eat and make good food choices. I do like to say that as tempting as it is, please do not advance your diets any earlier than what we advise you to do so. Advancing your diets too early can place you at a pretty high risk for surgical complications such as a leak or food items becoming trapped. Again, please do not advance your diets any earlier than what we advise you to do. All right? So, as far as that diet advancement, we do start you off day 1 in the hospital with what's called a clear liquid diet. Those are basically just fluids that you can see through. Chicken broth, water, Jell-O, pretty basic stuff. As long as you can prove that you're tolerating that, then at day 2, they'll move you to a full liquid diet. Full liquids are going to start from day 2 in the hospital, and they'll continue until you've had your very first post-operative visit. So you can expect to be on that clear liquid diet for 1 to 1.5 weeks following your surgeries. The liquid diet, that full liquid diet, the items that are permitted are all here on page 4, pretty much from here down. So what I would do is go through this list, find the items on here that you like and feel like will tolerate following surgery, and go shopping and preparing these items beforehand. That way you're not scrambling and having to find somebody to run to the store for you. The most important thing to have on hand other than water would be protein shakes. When you're on a liquid diet, it's very difficult to get in that 60 to 80 grams of protein that's required on that diet. So protein shakes are going to bring you to that goal. All right, so when you are finding a good protein shake, you want to find one that's high in protein and low in sugar. So generally a shake that is 15 grams of protein or more and sugar, 5 grams of sugar or less, is considered a good protein shake. Again, you can find a good list of protein shakes right here. This is not an exhaustive list. These are just some of those more popular shakes that people tend to like and are easily found. Let's see. All right, so then on page 5, we'll move on to a pureed diet. The pureed diet starts about, again, week and a half following your surgery. You're going to come in for your very first clinic visit. We're going to check in with you and see how you're doing, making sure that you're tolerating your liquids when you're swallowing, that it's going down okay. Just kind of check and make sure that everything is going as planned. As long as it is, then we do advance you to what's called a pureed diet. Pureed foods are basically the consistency of baby food and applesauce. If you think of those items, the food does not contain any chunks or lumps. It's very smooth consistency and you're not really having to chew it. Okay, I know it doesn't sound like the greatest stage in the world, and it isn't, but it does happen and it goes by fast. It's very necessary, so please stick to this pureed diet. Okay, you can use your food processor, you can use your blender. Some have asked me if they can use baby food, prepared baby food that they buy from the store. There's absolutely nothing wrong with that other than the flavor may not be the best. So again, you're able to do that, but honestly making your own is easy, cheaper, and a lot tastier. So on that pureed diet, again, your protein goal is 60 to 80 grams a day. Your protein goal starts from day 1 from surgery all the way through your lifetime. All right, so it's a long time. 60 to 80 grams protein goal, and then the hydration goal is 64 ounces of fluid. So 64 ounces of fluid is your protein goal right now before your surgery. That doesn't change after surgery. What will change after surgery is the amount that you're going to be able to drink at one sitting. Your stomachs are going to be reduced in size, so the capacity of your stomach is not going to hold as much water at one point in time. So that's why we're recommending carrying whatever your beverage of choice is, preferably water or unsweet tea, carrying your drink with you and having that available to sip all throughout the day continuously. All right, to make sure that you're hitting that intake of water goal that we're recommending. So on that pureed diet, the items that you're allowed to have would be softly cooked vegetables and then pureed down. Canned tuna or chicken, you can puree those with a little bit of chicken broth or low-fat, fat-free dressing. You can puree cream soups, cooked cereal, applesauce. Just be sure that the applesauce is no added sugar applesauce or natural applesauce. Cottage cheese, the reduced fat small curd is fine here. And then mashed potatoes. Mashed potatoes, just be sure that they don't contain any lumps, that they're very smooth and thin, and take it slow. Again, that pureed diet lasts for 2 weeks, and then we'll advance you to what's called a soft diet. Soft diet is just that. It's a diet that's very soft, easy to chew and digest. So you want to avoid things that are crunchy, raw fruits and vegetables, seeds, anything doughy like breads, rice, pastas. Those are all things to avoid here. They're not tolerated very well, and they can cause you harm after surgery. So the things that you are able to eat would be softly cooked vegetables. Just be sure that they're not too stringy, they're not too fibrous. Something that comes to mind would be asparagus, that's a little too fibrous at this point. So just really soft vegetables, carrots, squash, cooked green beans, broccoli, cauliflower, the floret, like kind of the top flowery part would be fine, avoiding the stems or the stalks. Other things to have would be canned fruit that's packed in its own juice or water versus syrup. Do avoid syrup. Soft meat, so you can have your chicken, your turkey, your fish at this point, but red meat we do ask you to avoid. If you think about red meat, it's often pretty difficult to chew and digest. It's not very well tolerated, so please avoid that at this point in time. Eggs, pretty much any way you like them, scrambled, hard-boiled, poached, in an omelet. However you like eggs, you're able to have eggs at this stage. And then again, do avoid breads, rice, pasta. They are technically soft food, but when you eat those items, they tend to kind of gum up in your stomach and leads to nausea, vomiting, just kind of general food intolerance, and they can also cause you harm following surgery. Moving on to page 6. This is where we'll go into the regular diet. So at this point, we're adding all kinds of new foods back into your diet. We often refer to this stage as the trial and error process. Some things you'll find that you'll tolerate and other things you won't. One thing I've learned very quickly being in this role is that everybody is very different. What one person may tolerate, another person may not. Doesn't mean that there's anything necessarily wrong with you or your surgery. It's just everybody and everybody's is different, all right? So we have composed some general guidelines that we would like you to keep in mind when you are making those food choices. Just kind of keep these guidelines in the front of your mind. I'd like you to take a look at this list 2, 3, 8 times. Just really familiarize yourselves with this list. And as long as you keep these guidelines in mind when you are back on regular foods, everything should go pretty smoothly for you. I'm going to go through each one of those guidelines. The first one is to avoid drinking liquids 30 minutes before and an hour after eating. The reason we have that rule is because if you are drinking with your meals, what that's doing is it's pushing food through your stomachs faster, so it's decreasing absorption of some of those key nutrients, and it also causes you to become hungrier quicker. So I like to use the example of applesauce in a funnel. All right, if you think about a funnel, which is your stomach, and then you were to put applesauce on top of that, in the funnel, the applesauce is going to slowly trickle through, and that's exactly what we would want it to do in your stomach. But on the other hand, if you were to take water on top of that applesauce through the funnel, it's going to wash it through the funnel a lot faster. All right, and that's what liquid's going to do inside your body if you're drinking liquids with your meals. So we want to give your bodies as much time as possible to absorb those nutrients, so really take the time, okay? We'd like you to eat slowly and chew well. It should take everybody 20 to 30 minutes to eat your meals. So watch your clock in the beginning if it's helpful. Take very small bites and chew really, really well. We can't stress that enough. We'd like you to avoid the sugar and high-fat foods. They can cause what's called dumping syndrome in my gastric bypass patients, and that's because we've rerouted your intestines after surgery. So if you eat food that is high in fat and high in sugar, your intestines are not equipped to process those as your stomach is. So what happens is it pulls a lot of fluid into your small bowels, and it leaves you feeling very uncomfortable. Nausea, sometimes vomiting, abdominal cramping, and diarrhea. A lot of people do see a positive in the negative. A lot of people see that it's a positive mechanism that does prevent them from going back to old eating habits. So I don't want to scare anybody away from having surgery. You can look at this as a good thing, but it is something that is very serious, and you do need to avoid those high fat and high sugar foods following surgery. If you use any artificial sweeteners such as Equal, stevia, Sweet and Low, what are some other ones? Splenda. Those things we are fine with people using following surgery. They don't affect your blood sugar. They won't cause you to have dumping syndrome, so those are fine. Okay? Continue to avoid red meat in the beginning. Just like I said previously, red meat's often difficult to chew and digest, not very well tolerated. So I would recommend to avoid red meat until you've kind of gotten a good grasp on your diet and you know what you can and can't tolerate mostly. And then if you really want to try red meat again, just go slow. Start off with something lean, pretty easy to chew and digest, maybe like a ground sirloin or a filet, and again, just take it very slow and chew really well. Continue to avoid breads, rice, pasta. We do try to, have you avoid those things as much as possible, and that is for life, okay? Continue to stay away from unhealthy snacks. Oftentimes the kind of junk foods, the foods that are shelf stable, that are, kind of in the center of the grocery store, cookies, chips, cakes, candies, donuts, things like that, they're very high in calories and very high in sugar and fat. So what happens is you're able to, we call them slider foods, so you're able to eat those. They slide through your stomachs quickly because they don't have fiber, they're not keeping you full, and you're able to eat more of these high calorie foods. So even with the surgery, if you let these items creep back into your diet, it will lead to weight gain. So please try to avoid those as much as possible. We'd like you to get your protein in first and at every meal. So I'm sure by now you probably know that the goal of protein is 60 to 80 grams of protein a day. That's for life. Protein can be more difficult to get in following weight loss surgery than what it was prior to surgery, because your stomachs are a lot smaller. So people are oftentimes relying on those high protein shakes as a supplement. And then, also relying on other sources of protein, meat, beans, legumes, dairy, eggs, all of those things are very high in protein. So try to have, something of protein at each and every one of your meals and snacks, just to make sure that you are getting in your protein requirement and kind of spreading that out throughout the day. We'd like you to avoid fast food and the drive-through as much as possible. Really kind of prep your meals ahead of time is what I suggest. Kind of preparing on a Saturday or Sunday for your week will really save you time, money, and headache throughout the rest of your week, okay? Oftentimes we get really busy, and if we're not planning and preparing, we go for whatever is quick and easy, and oftentimes we know that quick and easy is typically not the healthiest of options. So really set yourself up for success at the beginning of the week, which will carry you on through the rest of the week. All right. We recommend plenty of fruits and vegetables. The fiber in those items, that's what's going to keep you feeling fuller, longer, and avoiding things like constipation. Constipation can be an issue following weight loss surgery, and it's typically because people are lacking in fluids and fiber. So those that do experience constipation, we often are increasing fluids and fiber, and the issue resolves itself. We recommend 5 small meals a day, so try not to let yourself get too hungry. I briefly mentioned, kind of planning and preparing yourself ahead of time, but we're recommending 5 small meals a day. Breakfast, lunch, dinner, and a small snack in between breakfast and lunch and dinner. Water, again, 64 ounces of fluid a day is your your fluid goal. So carry a water bottle with you. Have your fluids readily available that you can kind of constantly sip throughout the day to make sure that you are getting in the fluids necessary. All right, so I'm now on page 7. So before I move on to vitamins, I just like to recap the diet progression following surgery, because I know that portion can get a little lengthy. So that first day that you're in the hospital following surgery, you're going to be on a clear liquid diet, liquids you can see through. Day 2, all the way until your first clinic visit, you'll be on a full liquid diet for about a week and a half period. When you come into the clinic, we'll check in, make sure you're doing okay, and at that point we'll advance you to a pureed diet. The pureed diet lasts for 2 weeks, and then you go to soft foods for 2 weeks, and then back to regular foods. So that whole diet advancement process is a 5 to 6 week period. All right, a week of liquids to 2 weeks of pureed to 2 weeks of soft, and then back to regular foods. All right. So moving on to vitamins, Our next topic with vitamins, we just like to let people know that vitamin and mineral deficiencies have been observed in patients following weight loss surgery. So we do start supplementing your diets with these vitamins the first day after your surgeries. Even when you're on your liquid diet, we do start you back up on most of your medications and these vitamins. They do not have to be crushed and they won't have to be in liquid form. You're able to take pills, tablets, caplets, chewables, gummies. You can take all of those. But the important thing with your medications is that you're taking them one at a time. So each pill is going to have to be spaced out 5 to 10 minutes apart from one another. I know a lot of people may be raising their eyebrows at this point because you may be on a whole lot of medications and you're thinking, wow, that's going to be all day for me. It's going to be a lengthy process in the beginning, all right? Hopefully some of these medications will be able to come off of following surgery, but in the beginning, we really, really need you to follow this rule very closely. So what I recommend is, if you're able to, group some of your medications. Have a morning, an afternoon, and an evening group, right? Some of your medications are time dependent, where you have to take them at a certain point in your day, and I don't want you to change that. But some of your other vitamins or some of the other medications that you're on, if it doesn't really matter when you take that during the day, as long as you take it, then you can kind of play around with those. But again, 5 to 10 minutes apart, each one of those pills. The vitamins following surgery, we will give you prescriptions for. So it's up to you whether you take those prescriptions to the pharmacy, have those filled, or going to Walmart or Target and having these picked out over the counter. Either or is fine. You don't have to use the prescriptions that we give you. We just give you those prescriptions for ease. And sometimes people just toss them and prefer a specific over-the-counter, generic, chewable, flavored. That's fine. Just as long as what you are taking matches on this list, we're happy. All right, so after following surgery, all of my procedures, gastric bypass, the sleeve, and the duodenal switch, are going to take the following medications. You're going to have a multivitamin twice a day, or 2 a day. That's just an adult multivitamin, taking 2 of those daily. The next is a calcium citrate with vitamin D. Calcium citrate is 500 milligrams with 400 international units of vitamin D. You're going to take that 3 times a day. Sometimes people will ask, well, can I just take 1,500 milligrams of calcium once and then call it a day? Unfortunately, you cannot take all of your calcium at one time because your body only absorbs approximately 500 milligrams of calcium at one sitting. So it is important that you are spacing those medications out as appropriate, as directed. The next medication is vitamin B12. It's 500 micrograms daily. And then some of you may be placed on an iron supplement. If you're having the sleeve, if you're already not taking iron, you will not be prescribed iron. However, if you're having the gastric bypass or having the duodenal switch, we will be prescribing iron if you have regular menstrual cycles or have already been diagnosed with anemia. The important thing with your iron is that you are avoiding taking that within 2 hours of taking your calcium. The calcium can block iron absorption. So we'll make sure to put those directions on the bottle, but if you're one of those people that would prefer to purchase your own vitamins over the counter, that's fine. Just keep in mind to avoid taking iron within 2 hours of taking the calcium. Okay? With the duodenal switch, you do have some additional vitamins that you do have to take, which are on your packet. You will have to take what's called fat-soluble vitamins, A, D, E, and K. So we'll make sure to get you squared away with those vitamins. And on your packet, there's also more information about that. On page 8, some additional medications that you'll have at discharge. You'll have Tylenol, which will be taken every 8 hours for the first 4 days after surgery. Levsin is to be taken every 6 hours for 4 additional days following surgery. And then Flexeril is a muscle relaxer taken 3 times daily as needed. So those 3 previous medications I just mentioned are part of that new protocol that we've initiated to help reduce the need for opioids following surgery. Could be found more information about that in this packet, but that's what that's about. You will have, I don't want anybody to be alarmed, if you did have moderate to severe pain following surgery that was not relieved with the Tylenol and the Flexeril, we do prescribe some opioids for you. Oxycodone, 5 milligrams, can be taken every 6 hours as needed for that moderate to severe pain. Okay? You'll have Colace, which is a stool softener. Take that as needed. I would take that until you've had your first good bowel movement following surgery. You'll have Pepcid, which will reduce acid in your stomach following surgery. If you've already been taking something such as Nexium or Prilosec, you will not take Pepcid. They'll continue on that medication. You'll have Zofran, which is an anti-nausea medication as needed. So should you experience that following surgery, you've got that in place. And then the last medication that we'll be prescribing in this long list of medications is Actigall. Actigall is to be taken twice a day to prevent gallstones following surgery. If you have already had your gallbladder removed, this is a medication that will not be prescribed to you. If you have your gallbladder currently, you will be expected to take Actigall twice a day for the first 6 months following surgery. This medication again reduces your risk of gallstone formation. When you lose weight quickly over a short period of time, it puts you at a high risk for gallstone formation. This medication will again help prevent that risk for formation. And then the next topic is activity. Activity is really important following surgery. We really encourage, if you're able to begin walking as soon as possible following surgery. The more that you can move and get that blood circulating, the less likely you are to develop things such as blood clots, okay? So please refer to that physical therapy assessment that you would have had prior to surgery and work on some of those activities that they would have given you in a plan, okay? You will have some restrictions following surgery. You won't be able to lift, push, or pull greater than 10 pounds. So anything that weighs over a full gallon of milk would be considered 10 pounds. So be careful with small pets, children. Most cannot be lifted following surgery. Household chores will also need to be avoided, and I am happy to talk to anybody's spouses that need an extension on that too. As far as driving, we don't want you driving while you're taking any narcotic pain medication. So that oxycodone that we talked about, that is considered a narcotic opioid pain medication. So we don't want you driving if you had been taking that within the last 10 to 12 hours. However, if you're off of opioids and you feel comfortable reacting to normal driving situations, then it is okay to drive again. And then people usually go back to work anywhere between 2 and 4 weeks following surgery. And then kind of highlighted in the, center to the, towards the bottom of that page, it just talks about some pain and soreness that you're going to have around your incisions. I'm sure you all know that there is going to be some pain following surgery. But I do like to point out the additional pain you may notice in one particular area over the others. So if you're having surgery by Dr. Egan, you tend to have more pain located on the left side of your abdomen. And if you're having surgery by Dr. Eckhouse, that pain tends to be more localized on the right side of your abdomen. And that basically is, it depends on how the surgeon's technique, all right? So the largest incision is either on that left or that right side. It sees the most manipulation of the tools, so you're left with a little bit more pain. Again, just the surgeon's technique, so just know that that's an expected outcome following surgery. It does alarm people sometimes because they see all of their incisions and they kind of look the same, but you have more pain on the one or the other side, and it does kind of alarm people. But just know that that is a normal and expected outcome as long as your incisions look okay. So as long as they're not red, swollen, feel hot to touch, draining, then they are typically okay. Anything that you think is unusual, uncommon, that alarms you, please don't ever hesitate to call the office, okay? One other thing I like to point out, if you're having surgery by Dr. Demus, she does tend to use the robot to do the operation. Her patients tend to not notice as much of the localized pain on the left or the right side, so just keep that in mind too. Didn't want to leave any patients out. And I don't know if I mentioned or not, but that pain will last 4 to 6 weeks following surgery. Ice and heat and rest will help that. On page 9, some additional things that we would like you to call the doctor on. If you have a fever of 101 degrees or higher, please call us. Any sudden shortness of breath or chest pain, that is something that we would first like you to call 911 and then eventually let us know, but that is considered a very urgent or emergent matter. If you have any pain, redness, or swelling in one or both of your legs or arms, it could be a sign of a blood clot, so we would like to know that immediately. If you have any persistent nausea or vomiting, any severe pain in your belly, or again, any issues at all with your incisions, any pain, like excess pain that you're not sure of, redness, swelling, drainage, if the incisions look like they're opening up at all, we would like to know about that. Our phone number is on that packet right here and every other paper we've given you. But again, our phone number is 314-454-7224, option 2 for the nurses. And we're here Monday through Friday from 8 a.m. until 4 p.m. We are closed for lunch between 12 and 1, so just keep that in mind. And then our very last page to go over are just some potential concerns of the surgeries. So we talked about that dumping syndrome. Again, it can occur after eating the high-fat, high-sugar foods and those that are having the gastric bypass. So we do ask that you avoid that if at all possible. All right. Again, people do see it as a positive mechanism that does prevent them from going back to those not-so-great eating habits. But sometimes you slip up, whether it be on purpose or by accident, especially if somebody else is preparing the food, you're not quite sure what's in it, you may experience a dumping syndrome. So just hang in there. It does get better. Rest, drink fluids, and it will typically get better within a couple of hours. Also, if you're having the gastric bypass, because we are rerouting the intestines, it is, and reducing the size of your stomach, it is more difficult to diagnose things such as ulcers, bleeding, malignancy, should you have those after surgery. So just keep that in mind. Also, if you have to have an upper endoscopy, that is an upper scope that they go down with a probe that has a little camera on the end, take a look around. Make sure that you are going to a physician that is aware that you've had your stomach altered and that is also experienced and comfortable with scoping patients that have had bariatric surgery. We have plenty of doctors between Barnes and WashU, but if you do go outside of our network, just make sure that you do that research on the physicians. Over-the-counter medications. I get calls a lot about this. So people may call with gas or constipation or it's cold and flu season, they've got secondary upper respiratory infection, what can I take? So it's okay to take most over-the-counter medications. We will talk a little bit more about what medications to avoid in a minute, but for increased gas, it is fine to take an over-the-counter anti-gas medication. Simethicone, Mylicon, Gas X, those are all fine and safe after surgery. Constipation, kind of the same thing. Over-the-counter laxatives are totally fine, so don't, as they say, suffer in silence. Go to the store, get a laxative, an enema, a glycerin suppository, all of those are fine should you need those following surgery, okay? What else? Over-the-counter medications for like colds and allergies are typically fine. I would just keep an eye on the cough syrups. Syrups could have a lot of sugar in them, which could lead to a dumping syndrome. Okay, so avoid those. But if you're ever placed on like an antibiotic following surgery, that's fine. To take oral steroids, if you're ever placed on an oral steroid, prednisone for instance, please let us know. That is typically okay, but we do like to know ahead of time there may be another medication that we have to place you on to protect your stomach while you're on that steroid. And then another thing to talk about or mention would be your incentive spirometer. That's just a fancy term for a little plastic device that sits about this tall and it has a tube on the end of it. I wish I had one to show you, but I'm in my office right now and I don't, unfortunately. But the nursing staff will show you how to use that and instruct you. They're going to ask you frequently how often you're doing that and what your numbers are. And the idea with that is that you are taking big inhales through this little tube and bringing air into your lungs. What that's going to do is keep your lungs healthy following surgery and help prevent things such as pneumonia. All right. And when you put your mouth on that, it is yours to keep forever. We won't take it back. So take that home and make sure that you're doing that at home. They say 10 times every 1 to 2 hours while you're awake. Women, if you are of childbearing age, we do need to make sure that you are using some method of birth control to prevent pregnancy for the first year following surgery. Just keep in mind that oral contraceptives, the birth control pill, if you're taking that following the gastric bypass, that hormone may not be fully absorbed. Because the gastric bypass is a malabsorptive procedure, we could run into some trouble. So we do recommend, if you remain on the birth control pill, to make sure that you're using a backup or a barrier method of birth control to prevent pregnancy for that first year following surgery. When you're losing weight very quickly, like you will all be doing, becoming pregnant during that time period, that first year, can be very, very dangerous on you and a developing fetus. So we do have to take all measures that we can to prevent that from happening. All right. On a good note, when you get past that point, we have had many patients have many children and they are healthy and here to talk about it. So just during that first year, we do need to avoid it. We also ask that you work closely with those doctors that are managing any of your medications, any of your conditions prior to surgery. So if you're somebody that's on high blood pressure medications or diabetes medications, we will definitely be managing those and adjusting those as needed when you're in the hospital. However, once you discharge from the hospital, we do want to transition that care back to those specialists. So that way we can focus on your bariatric surgery and your cardiologist can focus on your hearts, all right? The recommendation would be to follow up with your primary doctors the first month following your surgery. Hair loss is something that we do talk about following surgery. It is something that can occur due to the rapid weight loss. When you lose weight very quickly, it can, cause hair loss. It's something that it affects some worse than others. There's really not a whole lot we can do, once that's happening, other than, of course, getting in your required nutrients, your protein, your vitamins, eating a healthy diet. That's going to prevent any additional hair loss. What some have asked is, can I take a hair, skin, and nails vitamin or biotin? And that is completely fine and safe to take following surgery. So if you are worried about hair loss, again, over-the-counter biotin is fine. As far as dosing, you would just take it as directed on that bottle. Another thing, one more, jab with protein. A lot of people find that in order to get their daily protein requirement in, they're having to supplement with those protein shakes. Over time, you may get burnt out on the shake. In the beginning, you may just try a different flavor, a different brand, a protein smoothie, but eventually you may feel a burnout. So I highly encourage everybody to take a look at our Pinterest page. Our Pinterest page can be found on that meal planning 0 to 6 weeks after surgery packet. There's the link there. I highly encourage people to go on there. We've penned so many different recipes and ideas and exercise, all things bariatric you can find on that page. So, try looking there for some recipes, but it does cause us to be a little bit more creative once we do get to that point where we're kind of at a burnout stage. So I encourage you, if you're getting burnt out and you're not really sure what to do, please take a look at that Pinterest page. Please come to our support groups. They are the second Monday of every month from 5:30 to 6:30 p.m. at the Barnes West County Hospital. They're free and you don't need an appointment. Our website has a list of the dates and times, then I'll also add that in the attachments. So we really, really highly encourage people to attend those, especially those that may be struggling following surgery. It's a good place to come, learn a few things, network with other patients that are most likely going through or have already been through the same thing that you're experiencing. Each group's a little bit different, so I've got speakers, I'll have the dietitians, physical therapists, surgeons, nurses, plastic surgeons, nurse practitioner. Everybody kind of shares those support groups, so there is a full schedule. Please look at that and try to attend as many of those as you can. Maybe just make a small commitment to attend one and then see how you feel about it. But just with that protein, kind of to bring it home, we just want everybody to know that the protein requirement is just that. It's not a suggestion and it's not an option. It is a requirement. This is a commitment that everybody does need to make going into surgery, that you are committed to getting in 60 to 80 grams of protein a day. All right. If you are not able to make that commitment, then we really need to be talking. But most are, and most people are very successful following surgery and are very happy with the results. So, very last thing to talk about would be smoking and NSAID use. Those do need to be avoided following surgery. They can increase your risk for gastric ulcers and can be pretty detrimental to your anatomy. Smoking not only can cause ulcers, but it can delay tissue and wound healing following surgery. So they are very strict about that. They actually test you at your pre-op visit for nicotine, and then they test you on the day of surgery. So please, if you're smoking, we do need to know about that, and we need you to quit. Also, if you are around anybody that does smoke, so if it's a family member, a friend that may be smoking in the same house as you, in the car with you, if you work, or frequent a casino, that may set you offer nicotine, give you a positive nicotine test. So we do need you to avoid those places and those situations that you're around nicotine, because even if you are not smoking yourself, you can be tested positive for nicotine, which would result in postponing and canceling of your surgery. So I just like to let people know that. And then again, with the NSAIDs, the ibuprofen, Advil, Aleve, Mobic, things like that do have to be avoided following surgery. Tylenol is what they do recommend for that mild to moderate pain. So Tylenol is what we suggest. And then if you have like arthritis, or if you really have to take an NSAID following surgery, the surgeons do allow Celebrex. It's available by prescription only, and it is a little bit gentler on the stomach, so the surgeons do okay that. The last couple of pages on here, it's just a food list, foods that we see day to day on an American diet, just to help you as you're navigating through that 1,400 calorie diet prior to surgery. So that concludes this video. Again, I thank everybody for watching this, and if you have any questions at all, feel free to call the nurses. There are 2 registered nurses here. Our names are Ashley, so it is very easy for you to remember that. And again, our phone number, if needed, is 314-454-7224, option 2. Take care, everyone, and have a great day.